My name is Getaw Alamnie. I'm a plastic and reconstructive surgeon currently working at Yekati 12 Medical College Hospital, and I'm also an assistant professor of plastic and reconstructive surgery at Getaw University School of Medicine. And currently I'm a fellow of clean cut for Cleft in Smile Train Lifebox safe surgery and anesthesia initiative program. As a plastic and reconstructive surgeon, my work usually motivates me in a way that we're dealing cleft lip and palate patients, and these patients usually are discriminated in their community, in their neighborhood, and transforming these kind of patients with surgery. The parents, the family, they praise us with their words. You can see the happiness on their face, and you can see the child, the child's smile being transformed, their look being transformed. That inspires me daily, and it is a great motivation for my job. Cleft lip and palate patients have its own risk when it comes to surgery and anesthesia. One thing, the area where we are operating is shared by the surgeon and the anesthesia team. So the fact that the area is being shared by both the anesthesia team and the surgeon, there will be a continuous manipulation of the endotracheal tubes. So that may result in dislodgement of the endotracheal tube, or it may dislodge into the esophagus, or there may be accidental extubation while manipulating the tube intraoperatively. And the other one is there is also a very small margin of error in that area. Very small bleeding in the oral cavity will pose significant complications in the airway. And the nature of the surgery itself, a cleft lip and palate surgery, tends to narrow the airway. So in the immediate post-operative period, a compromised or narrowed airway may result in trouble in breathing. And there are certain things that we use in the mouth. We insert a throat pack, and throat pack may be forgotten, so that may result in impaction and airway compromise and intraoperative cardiac arrests. And there are also other operative and anesthesia-related complications. So it is kind of surgery where margin of error is very small. Children, by their nature, are not little adults. So children have their own physiology. They have unique physiology compared to adults. So it is good to have safe surgery overall, but we emphasize this program on pediatrics because, as I said, surgery or anesthesia in children have a very narrow margin of error. So we cannot tolerate errors in pediatrics. So within the context of cleft lip and palate, clean cut is a program adapted for cleft patients to reduce post-operative surgical site infections and cleft-related surgical complications. So this is done by employing or introducing a checklist-based program, which consists of, washing hands and surgical field with a proper antiseptic, keeping the integrity of the OR gowns, drapes, and glove, and proper and timely use of prophylactic antibiotics, keeping the sterility of instruments and OR materials, and the use of safety surgical checklist and proper count of gauze and instruments. This really reduce surgical site infections and other related surgical and anesthesia related complications. So clean cut, I believe, will impact surgical and anesthesia care of cleft lip and palate patients, because, as I said earlier, this program is based on a safety peri-operative checklist. So the fact that you do your job with a certain checklist and being adhered to that checklist will reduce the occurrence of these unprecedented or unexpected complications, and it will also result in a better outcome in terms of morbidity and mortality, and it will significantly reduce post-operative infections and other anesthesia and surgery-related complications. And the program will, I believe, have a great impact on achieving these goals.